usually have a supply of 75 gram glucose by some think some organization in the south, they have packeted the 75 gram glucose. Now you, if you look into the textbook, it is written 75 gram anhydrous glucose. So what is supplied in the market is not anhydrous, because glucose cannot become anhydrous. If you keep in the air, then actually they attract the water. So naturally it is not anhydrous glucose. So if you take the normal available glucose in the market, you have to take little bit more. It is 82.5 gram. So 82.5 gram, measuring 82.5 gram out of 100 gram packet is another issue. So that is why in majority of the situation, I think that the fasting blood sugar give you an adequate information to diagnose a case as diabetic or non-diabetic. Yes. Yes, you have to take unrestricted carbohydrate, and you should be a fasting of at least 8 hours, 8 to 14, no smoking, no alcohol, no tea, and only thing you can take water. Water is allowed. So that should be available. So this is it. So we are now clear. We learned that the fasting plasma glucose, actually they have written blood sugar, but I think majority of the laboratory actually check plasma glucose. It is not blood sugar. Blood sugar is not the right word, I think. The fasting plasma glucose 138, if we get a repeat sample or repeat value of more than 126, more than equal 126, then we can diagnose the patient as diabetes. Answer is that there is a possibility of diabetes, but we have to retest the patient. That is the answer. Now this is Mrs. Z, 48 years old. Her BMI is 32. She has no family history of diabetes. She is suffering from weight loss, polyuria, polydipsia for the past 6 months. Her casual plasma glucose 335. I think there is no controversy as far as the diagnosis is concerned, and I don't think that we require any more tests to confirm the diagnosis. We need other tests to evaluate the diabetic status of the patient. Maybe we require hemoglobin A1C as a baseline value, we require the cholesterol, that is a separate issue. But for confirming the diagnosis, we don't need any other test. We may or may not, because with this information it appears that the patient has type 2 diabetes, because patient has presented at 40 years old, patient has a BMI of 32, so obese, late presentation, probably the patient is suffering from type 2. But as the patient has got a polyuria, polydipsia, polyphagia, weight loss, these symptoms, so that goes in favor of type 1 diabetes, because type 1 diabetes usually presents with symptoms. Family history you have to take. So it appears that the patient has type 2. So what is the natural history of diabetes? Natural history of diabetes is that the patient from a normal glycemic status, they progress into pre-diabetic state, then into clinical diabetes, then into complication, and then at the last they may die from the complication. So this is the way it progresses. This chart actually shows us that we can reverse the pre-diabetic state to normal, provided we have taken good intervention to control the pre-diabetic state. So there is a possibility the patient can go back to normal, and from the clinical diabetes the patient may go back to pre-diabetes. But once the complication has started, then probably this is a progressive course, and probably it may not be possible for us to reverse back the majority of the complications. Once the complication has developed, it is irreversible. So our intention or the objective of managing a diabetes is that we want to prevent the development of complications in a type 2 diabetic subjects. You can see that patient say fasting blood sugar is 140 and postprandial blood glucose you can say 230 and glycosylated hemoglobin of 8.1, 8.2 or something like that. The patient may not have any symptom. The question is that why we are going to treat the patient, because the patient usually come to a doctor, I say in the majority of the situation 99% case, either of the three: 1 pain, 2 bleeding, 3 fever. Just think about yourself. Whenever you see patient, they have this either of this combination. But in diabetes there is no pain, no bleeding, and there is no bleeding, no pain, and there is no fever. So it is the responsibility of the physician to convince the patient that even though you do not have the symptom, even though you do not have any problem at present, there is a possibility that you will develop complications in future and which is very difficult to reverse back. So it is better that you should take a good action, good control of your diabetes today to prevent the future complications to occur. So that is the objective of the treatment. So this is the criteria for the diagnosis of impaired glucose status, impaired glucose homeostasis fasting. This is 110 to 126. This is the WHO criteria, and in ADA criteria is 100, as I have told you. Now this is inclusive of 100. So it means you can say equal, more than equal. It means this 100 is inclusive of impaired fasting glucose. So if the patient has got a fasting plasma glucose is 100, it means it is a impaired fasting glucose. Up to 99 is normal, and also in postprandial state or after 75 gram glucose up to 139 is normal. If it is 140, it is impaired glucose tolerance. So as I have told you, I will not ask if it is 187 is impaired glucose tolerance test or impaired glucose tolerance or not. No, we will ask it is 140 IGT or not IGT. That is the question. There is a question I usually ask in undergraduate, whether you have noticed this equal sign.
126 less than equal to 125 easy.
Yes, yes. ঠিক কনফিউশন হতে পারে। Post glucose plasma glucose, post glucose plasma glucose. So what is the diagnosis of this patient? Fasting glucose 120, after 75 gram glucose it is 209, urine glucose plus. Yes. This is fasting plasma glucose 96 and after 120 minutes of 186 IGT. Good. So after you have diagnosed that this patient is suffering from diabetes, now it is the responsibility to see whether this patient has got a type 1 and type 2, or actually there are 4: type 1, type 2, other, gestational. So these are 4. So whether the patient is suffering from type 1 or type 2 or gestational or others, that is the second